we'll be having a presentation shortly from Larry Frank and Eric Fox at Urban Design for Health. So, but right now we're going to start out with just some brief updates from Tom at the CDC.
Excuse me. Yeah, I just wanted to bring to people's attention some opportunities and brag a little about PAPRN in the past and blending over into the future. As people might know, America Walks sponsors what's called a walking college. They have 25 fellows that do a webinar and web-based training associated then with nationally known mentors who help them put together action plans to promote walking and walkability. The enrollment for that is open through April 15th, and it's only $100. There's only room for 25, but if any of your students or you or some of your friends in the community would be interested, I encourage you to just look up the America Walks page on that. Then the National Association of Chronic Disease Directors and us are putting on what's called an Action Institute. This is more of a group-based training where MPOs, based on an MPO structure, somebody from the planning, transportation, and public health form teams, and then they come for a training, again, working on how they can best promote walking and walkability as cross-sectional strategies. There's a report on that on the NACDD, National Association of Chronic Disease Directors webpage. That's already set for this year, but the people that have been in it might be resources for some of you guys that are doing things in the community and need either a structure or need some people with those skills. And finally, people that were in the original PAPRN would remember that the National Physical Activity Plan, which we helped form about 2008 and then was released in 2010, is going to be re-released as a new version on, let's see, the 20th of April. And I encourage people to follow on that, the changes that are made, and see how they can be a part of it. I want to give a shout out to Jackie Epping, who's been essentially shepherding this from day one, from 2006 on. And this is the culmination of a revised version. And so that's really things I just would let people be aware of.
Great, thank you, Tom. And so just also some brief updates from the coordinating center. I wanted to talk a little bit about the working groups. We had a call with all of the working groups in March and are really starting to make some forward progress on identifying project ideas. So if you are not already a part of the working groups and would like to join, we'll send out the link to the interest survey, again, with the call notes. So you can just fill that out and you'll be added to, there's also now a listserv for each working group. And so it's definitely not too late to get involved, and now's the time to learn about the project ideas that have been developed, and even if you have your own project ideas, it's not too late to bring those to the group. So again, if you have any questions about that, please reach out to me. I'll be sending a link out in the survey for you to express interest if you're not already a member of one of the groups. Any questions about the working groups before I move on from that? Okay. And then the other thing we just wanted to, each call we kind of bring up, if any of you have ideas for presentations for future calls, or if you yourself are interested in presenting to the group, please reach out to us and let us know. We want to have these calls feature some network members and topics that are of interest to the broad group. So please feel free to share those ideas with us. So with that, we're going to spend most of our call today hearing from Larry Frank and Eric Fox, who are at the Urban Design for Health. And they're going to share an early look with us at the National Environment Measures database. So we're really fortunate to have them with us and really kind of sharing this sneak peek with us. I think it's relevant to a lot of the work that you're doing and potentially also for the working groups for PAPRN. So with that, I'm going to go ahead and turn it over to Larry and Eric.
Thank you, Amanda. Thank you for the opportunity to present to PAPRN what we're doing. These are early days in this project, but I want to say hello to everybody. I know many of you. I see familiar names on this on the attendee list, so thanks for your time and interest. I'm going to also introduce Eric Fox. Eric has been working with me for 6 years through Urban Design for Health, but also Eric was my student over the last few years at University of British Columbia and did a wonderful master's project. He looked at worksite design and how the effects of where you actually it was at ALR. Eric presented it, but looking at the physical environment, built environment impacts of where people work when adjusting and controlling for home location on physical activity, and we'll have a few papers being submitted shortly to journals on that. So Eric will be presenting along with me. So this project was kind of grew out of a discussion. It was actually Tracy Orleans, I'll talk about it in a moment, approached us because as part of Robert Wood Johnson Foundation's Culture of Health, there was a recognition of the need for more detailed information on built environment, and we expanded that to look at built natural and social environment. The goal is to build a standardized set of metrics to characterize built social and natural environment and make something that's more consistent at the block group scale. And we'll discuss the trade-offs, and David Bergen's on the call, and Jamie Shariki is on our advisory committee as well. David made some comments on our advisory call earlier, about a week ago, which really speak to the geographic scale at which this database gets built. I, of course, and others along with me, I think, who've been doing research on this topic, want to make it as geographically flexible and scale unit of geography that we can build it at gives us spatial precision and allows us to deal with the fact, the proximity issues of how sensitive we are as the creatures moving around the environment to what's near us, that proximity. So the larger the geography, the more information you lose. So that's where we ended up right now at the block group scale. Lots of reasons for that, but there are some trade-offs. And the idea is to support analyses on a variety of environmental indicators as part of the culture of health. But of course, it's really to create a tool, a place for people to go to find information that can be aggregated up to different geographic scales. So Eric will go to the next slide. So we'll give an overview of the project and the variable development process that we're currently engaged in. We are very interested in your input. We think PAPRN is a wonderful a network to get feedback from, and this is perfect time to do it. It's very early days. We've been collecting the data that's available nationally, and I'll talk a little bit more, and Eric will present more detail on that. But we want your input and ideas of other data sets that we could add, measures that we could include, factors that we should consider at this time is perfect. We'll talk about types of variables and then criteria for inclusion. Of course, ways that variables get operationalized from base data is important, and we have different, obviously, methods and evidence that exists now. This is a developing field, but there's been a lot of work done by many of you that helps us determine what measures might be most relevant for predicting physical activity and other outcomes. We'll talk about composite variables. We'll draw examples. The prototype for this project actually was a Healthy Communities Atlas that we built for San Diego, for the region under an ARA grant, or CPPW came out of CDC and went to that region, and then they hired us. We'll talk about applying the data and how data is being applied. Is one example that we have is that we have another project happening exactly at the same time, very fortuitous, with the EPA to create a national model that will use the census block group data for those that want to do health impact assessment in their community. And then predicting health impacts and related costs. We'll touch upon that at the end. Next slide, Eric, please. So the leadership really comes from Tracy, and she's really been the visionary wanting to do this. We also have important leadership from RAND Corporation and others, and then Eric and myself, but really it's Tracy who's really spearheading this through RWJ. Next slide. So just urban design for health, what are we? So I'm a professor at University of British Columbia, was at Georgia Tech beforehand, but basically we have a bit of background and depth of experience in modeling built environment relationships. This is the mechanism by which we're applying research to decision making, doing a lot of very we've been fortunate. We've been working with a lot of entities, local governments, who want to use the research that you develop and we do as well to make better decisions. And we'll talk about some examples. But we've led a lot of research linking land use and transportation. Been working with many researchers over the years, long time. And then amongst we've been publishing a good bit. Key focus areas are tool and evidence. Based decision-making, objective measurement, surveying, and outreach. Next slide, Eric. So our advisory committee is David Berrigan and Jamie Shariki. We're on the call. Are you guys there? Can you? Okay, we'll know if you're there.
I'm here.
Okay. Hi, Jamie. Thank you for joining. And I don't know if David made it onto the call, but I think he said he would. We also, everybody knows, David working at NCI. Jamie's been building a lot of interesting evidence that will be part of this project, and a very important part on the regulatory environment. And I think many of you know Jamie's work, but we're very keen, and Tracy was as well, in looking at not only the built environment and what's on the ground in terms of inventory, but the work that Jamie's been doing, really mapping in a kind of a heroic effort of Herculean, really looking at the zoning ordinances across the country. So what's allowable and what's encouraged, and what's the culture in those places to support walkability. Dr. Chris Days at NYU, Melissa Jordan with Florida State Department of Health, Jim at UCSD, John Thomas at EPA, who's been responsible for really promoting a lot of the national data sets that we're using. And then Dr. Sandra Whitehead, that's our advisory committee. Next slide, please. So the role we have with the advisory committee is feedback on strengths and weaknesses, selection of data sources, areas of cautions, and review methods utilized to operationalize variables, and then to recommend potential end users and ways to further strengthen connections, like this call today. Next slide. So I think, Eric, this may be the point where you take over, and I look forward to the discussion, and I'll be on at the end. Thank you.
Thanks, Larry. Good morning, everyone. So we just wanted to go through and highlight what are the types of variables, some composite measures, weighting, and I'll go through and show some examples of some of the methodological issues for consideration that we're also dealing with, and then I want to show some visualization of sort of what we can do with the product at the end. So the core base of the data set that we're developing are utilizing existing publicly available national data sets, and so two of our main core data sets that we've started with have been the EPA Smart Location Database you're probably familiar with, as well as the Enviro Atlas. The composite measures are basically combining multiple variables together to illustrate something else, show some other pattern, which is definitely something that we want to include within this database. There's also the potential for region-specific new variable development using high-resolution data. Because we're doing this at the national scale, we can't replicate those variables everywhere at this fine spatial grain we're sticking to the block group geography, and we want to make the data set scalable to more aggregated geography, such as the metropolitan area. But we're considering the potential for including some important variables at the region specific for specific regions. And then lastly, sort of along the lines of dynamic variables, some of the variables that we're including, especially from the Census Bureau, can be updated frequently, and we want it to be. And so one of the first stages that we've done is we've taken the Smart Location database and included updated variables from the 5-year estimates for the American Community Survey, as well as the Longitudinal Employer Household Dynamics, or LEHD, which are a core component of the Smart Location database variables, and we've updated them to more current. So this allows for also some change detection with the dynamic variables, looking at how they're changing over time, and the database is something that we want to be updated into the future. So as we've sort of discussed already, but we want the main criteria for variables that we're considering is we want to focus on the block group geography. We want it scalable, so one of the first areas that we're looking at is the 100 largest metropolitan statistical areas in the country, and then also moving to the rest of the rest of the metropolitan statistical areas, and then also the potential for micropolitan statistical areas to represent these variables at more of a metropolitan level. We want national coverage, so we're really seeking data sets that have national coverage and that they're publicly available for use. So we just gave some sort of broad ideas of specific categories that fit into the built natural and social environment here. And then we can just go a little bit deeper and show some variable examples. So looking at bicycle facilities, some of the variables that we've developed in the past have been access to non-motorized trails, percentage of road networks with bike lanes. We're interested in tree canopy cover and are looking to gather some of that data from the Enviro Atlas, as well as social variables. So these communities of concern characteristics is something that we utilize for the Healthy Communities Atlas, which are MPO, the San Diego Association of Government defined characteristics for low income, low mobility, minority populations, and low community engagement. So these are just some brief examples. Again, we're assembling this large inventory from various databases, but this should just give you a bit of a taste of some of the variables we're looking at. So you may be familiar with the modifiable aerial unit problem, which is one of the issues that comes up when dealing with aerial units, such as the block group. So one of those issues is the potential for buffering these block groups to see how the sort of area beyond the aerial unit of the block group affects or is changing these variables in terms of buffered block groups versus unbuffered block groups. So we're testing this using 1 kilometer crowfly buffers, and we're looking at the block group population center. So this is something that we've not necessarily committed to, but that we're testing this to see how much difference we see between unbuffered variables versus buffered variables.
Eric, I just wondered if, sorry for the background noise right here. I wondered if you want to just define what is the analytical issue that when we talk about modify. Many people may not know what that is.
Yeah, so when the block group boundaries are created along roads and are defined by the census, but they're still arbitrarily defined, and there's always going to be an issue with how the variable is represented at the edge of this aerial unit. And so one potential way for dealing with the modifiable aerial unit problem is to buffer, to bring in aspects or a proportion of the nearby block groups when representing that block group. It's always going to be an issue when you're dealing with spatial problem solving, especially using polygon geography, but it can be limited, and this is one of the potential ways of dealing with it. So I said one of our main interests at the beginning is looking at the 100 largest MSAs, metropolitan statistical areas in the country. And so I just wanted to show some examples of where those 100 MSAs are, and I just use a variable here from the Smart Location database that's multimodal intersection density. This is an idea about how we can use, in addition to having the actual database, but how we can present and visualize the data. Not always appropriate at the national level, but we just sort of thought we'd show this example of a chloropleth, and here we can see higher intersection density, especially in the northeast, along the west coast, and definitely much lower in the southeast and other areas in the Midwest. Also at the beginning, in order to summarize some of this data, we've also been looking at the top 10 largest by population, most populous metropolitan statistical areas, and we just wanted to show a table of some of the draft results that we've got so far from the Enviro Atlas, as well as this National Highway Traffic Safety Administration Fatality Analysis Reporting System. And so we've broken these down for the 10 largest metropolitan areas, and we can see some patterns emerging. Philadelphia and Miami, much higher crash rates, as well as pedestrian-involved crashes. And other areas, you might not be too surprised with Los Angeles having fairly low forest percentage and a percentage of impervious surface cover. And then some other areas, a little bit larger natural area, Miami and Atlanta. This just gives you an example of summarizing some of these variables. Again, these are just mean values for the metropolitan areas, but this is something we can go from the block group and aggregate up quite easily to this level. So looking at that same FARS, total traffic crashes, sometimes the chloropleth map is not very useful, and in this case we just tested out looking at dot density of 10, each dot equals 10 collisions, and so we can see some patterns emerging. There's more crashes in Florida and in the two large metropolitan areas in Texas, as well as Los Angeles and in the Northeast. So lots of different examples about how we can visualize. And so as Larry mentioned, one of the prototypes for this project was the Healthy Communities Atlas, which we developed in 2012 for the San Diego Association of Governments. And so this was a compilation of about 33 maps, along with other tables and descriptives, looking at metropolitan San Diego, so especially the western third of San Diego County, if you're familiar with the area. And that was a compilation of looking at the base maps, so single variables, as well as combining those into composite maps. And so we wanted to show you some examples of these. So yeah, the Atlas was our prototype project, and what we're using is a bit of a model for what we're doing with this at the national level. Both of these were the block group geography. And so this first set of maps is just a base map, and so we did a quite intensive sidewalk inventory within the urbanized areas in San Diego. And so just from this map, we can see, especially in more of the suburban areas, less sidewalk coverage with some exceptions, such as Chula Vista down in the southeast, and maybe the Santee area as well. And the map on the right shows access to non-motorized trails within 2 kilometers or 1.2 miles. And so these were some of the base data sets, and we combined those to look at some composite measures. So trying to get at painting a picture about what are the patterns that we're seeing. And so you guys are probably familiar with the utilitarian walkability index. So this leverages net residential density, land use mix, intersection density, and retail floor area ratio. And the map to the right is transportation infrastructure support, which we combined access to transit, stations and stops, non-motorized trails, as well as sidewalks. And just a few other examples was pedestrian safety. This was a composite map that looked at the pedestrian crash rate, arterial density, and traffic volume density, as well as sidewalk coverage. And youth physical activity support looks at non-motorized trail access, park access, access to elementary schools, as well as sidewalks. So we just wanted to show this as some examples of what you can do with the composite maps and what we want to do with the NED moving forward. So I think at this point I'll pass it back to Larry to give us some more information about how we're the synergistic relationship with our EPA project, which is also at the national level.
Thank you, Eric. Just before we wrap up, we want to leave a good amount of time for discussion, which looks very promising. So we're developing just some of the ideas, and this is more in the kind of within the theme of how to use the data. We happen to have at the same time a discussion with the EPA and a project come along to build a national tool, and of course at block group level geometry is very appealing, is very logical, is what's available. It's the smallest unit of census that we know that has income available and many other really important factors that we need. But some regions will have better data and or more spatially precise information. And one of the things that we're looking at is we're going to be talking with many of you at CDC to work together on a lot of the work you're doing, which you just announced, looking at tools, in particular mapping some of the outcome data, the health outcomes across the country, and figuring out how that might integrate with this. So we're really excited about that conversation because we see a lot of work happening now, as you're probably all aware. Lots of new data sources are coming along. So one of this is to develop this tool, which would be a scenario planning tool, and these are the type of work that we've been doing a lot of, which uses a software platform that's been developed by urban planners, many of you heard of and know about, I'm sure, some maybe not, where it's like, if you remember the game SimCity, it's SimCity for real, where you can actually calculate built environment measures based on what users or community stakeholders want to see in their neighborhood or don't want to see, and planners and public health officials, we can actually show community groups what the health impacts directly are of alternative neighborhood development typologies. That's what scenario planning does. It's been used for environmental predictions, air pollution, greenhouse gas emissions, return on investment, water quality impacts, you name it. We've been bringing health for the last 10 years into scenario planning. That's the main thing Urban Design for Health has been doing. With a lot of the evidence and data we've been collecting with our colleagues, many of you. So we're developing a plugin which will connect with these open source planning tools via an automated plugin to expand the range of platforms. So there's a few of these different platforms, and this database provides a nationally available opportunity for people to use that tool, and is basically what that software tool will effectively eat in order to function. So we're going to test that and build the tool. We already are in California using the health interview survey data in California, and then it gets exported and used, will be nationally using the net is one example. Next slide, Eric, please. So just an example that shows how this data gets built out is in California, where we built a public health assessment model. This was for the state of California and the Sacramento Council of Governments, California Department of Transportation, and also the Southern California Association of Governments. And this is actually the Southern California Association of Governments application. It's going to show real quick. And it's how the scenario planning software works. This is Urban Footprint as an example. And it's basically, we built this tool for all the state of California's urbanized areas using the health interview survey data and incorporates address level. There we had address level information, so we're matching people's address information to their immediate built environment. The the national tool won't do that, but I know it's a little bit, I just wanted to mention this in passing. So this is something to look for, and we've been building these tools that I think will really be quite helpful, and want to engage other researchers involved because there's a lot of opportunity, we think, in this area. Next slide, please. So just real quick, some outcomes that you could see. So we're trying to predict things that may be relevant for your own research, looking at, in this case, adults age 18 to 65, recreational physical activity, walking, biking, automobile use, obese population, and we test these against the ways that people paint their future, how they want their region to grow, or their neighborhood area, or a corridor, and then come up with impacts. So you can see being reduced or increasing significantly cycling, and then reducing obesity from their, I guess, time in cars, minutes, actually automobile minutes daily goes down, and then you see blood pressure dropping off slightly, heart disease 3%. Roughly, and high blood pressure, and then type 2 diabetes. So just a little bit on what that outcomes have been. We've seen more significant impacts from others. And then I think I'm just going to wrap up. I just wanted to show that some of these, and this is exactly how these data sets are being used by us and others. So we'll hope to share more of that in the future. And I guess we have one other slide, which I'm just going to mention before, is that monetization. This is a key thing that we're doing in all of our projects, is the burden of disease, or looking at the healthcare cost reductions that we anticipate, because we know working with decision makers, this is a key issue, is in order to get motivation and buy-in from councils. This has really been a key factor, so we've spent a lot of time, and we think that the net can help feed into national application of tools that can help us all demonstrate that the work we're all doing together through PAPRN, that you're doing and others, I think really is economically savvy, makes sense. So with that, I'll conclude and look forward to discuss. I think we have one more slide that prompts discussion questions for you to think about, but we want to talk about sources of data that you may know about, and issues around variable development, how you might use this data, spatial scale, buffering, making composite measures, and finally, something really interesting is this is intended to be and visualized as something that, of course, would be updated over time. Otherwise, it would not be useful for us. So as it gets updated and we have new layers, we can subtract or look at differences or changes in on-the-ground built environment features that really provide an opportunity to maybe even develop a system of reward, in a bit of a report card for who's getting more walkable, and ways to make that heralded as an effort to promote public health. Thank you.
Great. Thank you very much, Larry and Eric. And as we said at the beginning, we wanted to leave some good time for discussion. It looks like we have a few questions that people typed into the chat box while you were presenting. So maybe we'll start there and then open it up. So just a reminder to everyone, your lines are open, so you can unmute yourself and ask your question directly. So just started, quick question. Do you know if the Healthy Community Atlas is available on Community Commons, which is the RWJF health database?
I don't know. It's online at the San Diego, so we have a URL to it, and
it's on the Sandag website, the actual atlas, and then there's also a tool that has an ArcGIS online where you can actually look at the maps and zoom in to certain areas. So we can provide those links for you as well.
That would be great, and I'll ask Chris Fulcher from Community Commons. I should know more about that, but I'm not completely sure how they add their tools and things to that database, so we can have that discussion with them. And then the other question that came in from Jamie was about sidewalk data. And the question, are you able to get sidewalk data nationally, or was that just from GIS data you had in San Diego?
So this raises a question, Eric, if you want to chime in too, but it's an example of many regions now do have sidewalk data. Surprisingly, it's growing quick. We were able to build it using remote imagery. We actually developed it under that CDC grant for San Diego, which is now using it. Sandag, the MPO, and others there. So we built the layer ourselves for the region, but many regions have been compiling that information, and so there's going to be this question around, well, many questions like this, where maybe 20 of the 100 really have it, or 10. What should we do about that? That's a lot of really useful data. So we're not quite sure how yet to treat when it's a critical thing like fundamental as sidewalks. Maybe there's some energy put into a subset of regions that we actually bring it in. Right now, of course, nationally, there's no national database of sidewalks, but this would be the beginning of it, and we think it's very valuable. So we're not quite sure yet what to do about it.
Do you have any idea for how long?
Hello? We can't quite hear.
Yeah, it sounded like someone was asking a question, but you were very faint.
Yes.
Okay, maybe it's so. There you go. Yep.
Oh, this is a different question.
Go ahead.
Since we're talking about sidewalks, is there any classification of sidewalks? Because clearly a 4-foot sidewalk is very different from 12-foot sidewalk and different contexts. So is it just sidewalk a catch-all term, or is there any segmentation of that?
Okay. Now we're down even in more detail, and that's a good question. Is that Dee? I couldn't see who asked the question.
Yes, that was Dee. I'm sorry, Dee Merriam in Atlanta.
Hi, Dee. I actually have to honestly tell you, I recognize your voice. I'm not even looking at who spoke. That is even going more in the direction of what do we do about, some regions we do know what side of the street where we've been building it. We know where they have sidewalks on both sides of the street. Width is not something that will probably make its way, especially into a national database, but so these are the kind of questions that we anticipated would come up. They're good questions, and we don't anticipate this national database. What I think we could do is, in the process of inventorying and accumulating all this data, maybe develop a matrix of who has some of these data sets and who doesn't, or who has it for instance, just to check off sidewalk data available in Baltimore at the regional level, because it's sort of that, but this alone would take us
Herculean.
Yeah, I was just going to add, Larry, just from the GIS perspective, I know in the metropolitan Seattle what they've done, the other issue is that not all the jurisdictions collect the sidewalk data using the same geometry and in the same fashion. So some of them do have things as low as detailed as width of sidewalk, but certainly that's not going to very common. And so there's nothing available at the national level, and we're going to investigate if we can bring that in for some specific areas, because it would be a quite valuable variable. But there is this it could be a tremendous effort to try to connect all of this at the national level. So,
Larry, this is for our PAPRN study. We're actually doing speed aerial photography analysis of sidewalks, along with a whole host of other street features for a sample of jurisdictions. And we actually just ran into this issue that, as you would imagine, smaller jurisdictions in particular, the aerial photography is really, really limited or minimal. And so we're able to get really good sidewalk and other data in larger jurisdictions, but as soon as you get to the smaller jurisdictions, we ran into problems and actually had to change our sample. So we're happy to talk with you offline about that.
Yeah, it sounds great. We should definitely talk about that. And we've only looked at it in some regions. Are you doing a collection? How many jurisdictions were you looking at just in?
So Eric, for our PAPRN study, we were doing detailed audits in 10. We were doing 10 southern smaller jurisdictions. That's originally what Source CDC was interested in, and we've had to revamp. This was a pilot, Eric, for exactly the reasons that Larry and you described. We were doing this pilot to try and figure out how could we get sidewalk data to link with all of our zoning data nationally. And of course, because we don't think small, we had this grandiose idea we could somehow do some type of sampling and get some sidewalk amongst other in the aerial photography. And so it's become pretty apparent, and we tried this over and over across jurisdictions in the Midwest, South, the West, and the Northeast, and it's the small jurisdictions in particular that are causing a problem. So even though you'll be in the 100 metropolitan statistical area, largest 100 metropolitan statistical areas, you'll have a lot of smaller areas in there. That'll be problematic from this perspective.
Yeah, there's definitely lots of challenges. I just know from the how you inventory the sidewalk data is you use a line geometry. So you basically use the center line of the road, and then you mark which side has sidewalk and any other details. But even some of that is different in terms of how the inventories have been collected, because they'll put the actual line on both sides where actually looking at the aerial imagery where the sidewalk is. So there's lots of issues regarding that in different jurisdictions. And really what we need is some standardized format that all of the MPOs are using, rather than trying to get all of the individual cities within the metro areas.
Great. We had a few other questions come in on the chat. I don't know if Larry, you can, and Eric, you can see them or not. So I'll go ahead and read the next question that came in. Since different areas will have different definitions of variables, what approaches have you thought of making them comparable?
Yeah, so initially we're just looking at the existing databases. We don't want to really replicate what other people have done with the SLD or the EnviroAtlas. And so that's our top priority, is getting the nationally consistent at the block group level for these variables. These other sort of specialty ones at the regional level is something that we're exploring the potential for doing. But at the sort of main core of it is that these should all be at the same level at the block group geography. That's the database that we want to produce. Is that sort of clear?
Yep, that makes sense to me. And then another question from Jenna Hirsch. Has there been any discussion of including Google Street View audits to get small scale / aesthetics?
We haven't discussed that. We're familiar with the micro scale audit of streetscape. I think it's the Maps tool. And for the online version, we use Google Street View to gather out. That wasn't something, because that is so micro scale. this needs to be a little bit more aggregated geography in order to be at the national level. That wasn't something that we were considering. And as I've seen it only done for specific routes from participants' homes or schools or work locations along quarter-mile routes. But that would probably be an inventory undertaking a little bit out of the scope of this project for the national scale.
Yeah.
Hi, everyone.
Janet, that's what we've been doing.
I was disconnected in the middle of answering a question, and I just got overseas right now. Sorry about that. I wanted to just make a...
Go ahead.
Yeah, okay. Sorry, just a comment around that this is the beginning, it's just the beginning of a platform, and I think these ideas are really important because it helps determine what priorities should be for going forward. But it's there's obviously a trade-off for doing something for 100 regions, maybe more in the future. That's the intent. Is it where can we start and make the most initial impact with data already available? But it doesn't mean that the data as it becomes available can't be added. For instance, green infrastructure. There's more and more data sets now that are very in a detailed way. That's what EnviroAtlas does, is measures tree canopy. So sometimes these data do exist.
Great. Hi, this is Kagan Bamer at the CDC, and I was wondering how you guys plan to identify your kind of final list of metrics, whether it will be based, on availability, or if you'll also be looking at the evidence behind, how these metrics correlate with health or different public health indicators or outcomes.
We'll be working on that question with our advisory committee. It's one of the core ones. Obviously, the universe of possibilities is, of course, based on what's available. And then within that, I think the question comes, what is the form of the variables that are developed? And ideally, that would be, in a form that is most known in the evidence to be predictive. But predictive of what? So certain measures, and for whom? So, is this the best measure of density to predict physical or walkability that we put together to predict physical activity? And then is that active transportation for utility or for recreation or for old or young or poor or wealthy? So that's all those kinds of questions come up. And obviously, for a first cut through this, we're going to want to be as broad and create as many potential, because users can make their own measures. If we provide the base information, then that's a decision that the researcher can choose. Well, I'm doing a study on older people, and I'm going to make my measures based on what the evidence shows for this group, or for urban and area people that have less means. So I think that what we heard from our advisory committee was provide as much flexibility as possible.
Great, thank you for that. And I'll just also mention that CDC worked with the U.S. Department of Transportation and released a transportation and health tool that's available on the DOT website, and it gets there's 14 indicators that were selected for final inclusion that show the link between transportation and health, and the data is available for several of those indicators at the MSA level. And so that might, if you're not familiar with that, it might just be a source, because we had some of the same criteria, but being nationally available and publicly available information.
Thank you. That was a great effort. We know of that, and we'll definitely be referencing that and other efforts like that as best we can. And we're looking to you to make sure that we're inclusive as we can be, because we may not know of everything that's going on. So that's one of the important roles that PAPRN can provide for us, is to make sure we do capture that.
And so the other thing I'll mention that you probably already are aware of, but is the CDC's Environmental Public Health Tracking Network.
Thank you. Do you want to mention anything, any more detail about that?
Sure. It's housed within the National Center for Environmental Health at CDC. It provides state level and county level data nationally on several indicators of environmental exposures, environmental hazards, and health outcomes. We at the Healthy Community Design Initiative have worked with them to put some community design metrics on there. We don't have a ton of them, but some that we have are access to parks or proximity to parks, proximity of population to schools, percentage of the population that lives near major roadways, percentage of schools located near major roadways. Those are a couple of examples of the community design features, but there will also be things on there with air quality. They worked with EPA to do some PM 2.5 and ozone modeling at small geographies that might be useful.
That would be. I think the issue is the geographic scale, and the question is not to, we don't want to debate what's been done. We're trying to come in at a smaller geographic scale.
Exactly. Right.
Yeah.
But some of the data sets may be, I was going to say, some of the underlying data may be available at geographic scales, but they've, for consistency, aggregate everything to county. I think they're moving towards census tract. I don't know when they plan to do that, but you're looking to get even smaller. So I agree. I think there's a lot of benefits being at the census block and allowing people to aggregate up.
Right. And maybe one of the things, and this was brought up on our advisory call, was that we do is perhaps we should aggregate to the tract. From the block group might be too small. That was raised as an issue. Has to do with confidentiality and reporting. But so that's something that came up. Yeah. Thank you.
Great. Thanks, Tegan. I was going to say it might be helpful if you want to share those sources as well, and we can send those out with the call.
Okay. I can send web links on both of them.
Great, thank you.
That'd be great.
We have time maybe for just one more quick question. We wanted to just wrap up with an open mic, but it's been a good discussion. So are there any final questions for Larry and Eric? All right. Thanks everyone for the great questions and great discussion. We knew there would be some good talk around this. So we're, again, just want to thank Larry and Eric for presenting to us today. We are fortunate to get kind of this early view of the database and are looking forward to thinking through how we can use it with the PAPRN network. So right now we just want to, I'll turn it back over. Larry, Eric, any final comments?
No, thank you for the opportunity, and we would love to, as we get further along, check in back with and give you an update as time allows for you based on your schedule. But maybe in a half a year or so, we can see if it's timely or whatever works best for you.
Great, and thanks again to Larry and Eric for presenting with us today. So again, we have just 4 minutes to wrap up. Does anyone have any open mic items? That could be anything from attending a conference or anything to add.
Amanda, it's Jamie. I'll add one thing. On the Complete Streets work group, if you're not part of it, you're welcome to join us on our next call. Amigo Atherton from the National Complete Streets Coalition is going to be presenting for us to tell us about the coalition and the work that they do. She'll also be providing us with input on our work group topic areas. But even if you're not part of the work group, we'd love to have you join us if you're interested in learning more about the coalition. And I'll do one more shout out for the work group. If you're part of the work group or signed up for it and you haven't completed your survey, please do so. Otherwise, you'll get nagged by Amanda or myself. Thank you.
Great, thanks, Jamie. Any other comments or updates? And I'll just say, I think I may have mentioned at the beginning for the working groups, are all really starting to target in on project ideas. So if you haven't received a project idea survey yet, you probably will be shortly. I know some of the groups may still be working on developing those, but there are some others that some of them are waiting for me to develop the survey, so I'll be working on that. Just if you have any questions about the working groups, just let us know. Okay, I think with that, then we will go ahead and wrap it up. We'll send a follow-up around with the different resources that we talked about today. I'm not sure if we're going to be able to actually share the full recording today's call because they presented some data that's not public yet. But they are going to share some slides with us that remove any of the information that can't be released yet. So we will at least be sharing slides from the presentation and some just quick follow-up. So I want to thank everyone again for your participation and questions, and we'll look forward to talking with you next month. Have a great weekend, everyone.
Great job. Thanks much.
Thanks, bye.